Question 1. Which is true about synovial joint? A. Stability is inversely proportional to mobility. B. Hyaline cartilage covers articular surfaces of all synovial joints. C. Metacarpophalangeal joint is a hinge joint. D. Cartilage usually divides the joint into two cavities. The correct answer is A. Stability is inversely proportional to mobility. Question number 2. What is the uppermost structure in left lung hilum? A. Pulmonary artery. B. Pulmonary vein. C. Bronchial artery. D. Left mainstem bronchus. The correct answer is A. Pulmonary artery. Question number 3. Level of lower border of lung at mid-axillary line is A. 6th rib. B. 8th rib. C. 10th rib. D. 12th rib. The correct answer is option B. 8th rib. Question number 4. True about anatomy of right ventricle. A. TV and PV share fibrous continuity. B. More prominent trabeculation. C. Crista supraventricularis separate tricuspid valve and pulmonary valve. D. All. The right answer is D. All. Question number 5. Which of the following is not supplied by the anterior division of mandibular nerve? A. Temporalis. B. Medial pterygoid. C. Lateral pterygoid. D. masseter. The right answer is B. Medial pterygoid, as it is supplied by the main trunk of mandibular nerve. Question number 6. Nerve supply of stapedius is A. Second nerve. B. Third nerve. C. Fifth nerve. D. Seventh nerve. The correct answer is D. Seventh nerve, that is facial nerve. Question number 7. Small muscles of hand are supplied by A. C3. B. C4. C. C6. D. C5 to 7, C8 to T1. The right answer is D. All small muscles of hand, that is thenar, hypothenar, interossei and lumbricals, are supplied by median and ulnar nerves, which originate from C5 to 7 and C8 and T1 nerves. Question number 8. Nerve damage due to lunate dislocation in carpal tunnel. A. Median and ulnar. B. Median. C. Ulnar. D. Radial. The correct answer is B. Median nerve. Question number 9. Tibial nerve injury or palsy causes A. Dorsiflexion of foot at ankle joint. B. Plantar flexion of the foot at ankle joint. C. Loss of sensation of dorsum of foot. D. Paralysis of muscles of anterior compartment of leg. The correct answer is A. Dorsiflexion of foot at ankle joint. Question number 10. A patient presents with defective adduction of the hip joint and pains in the hip and knee joint. Which nerve is involved? A. Obturator nerve. B. Femoral nerve. C. Saphenous nerve. D. Sciatic nerve. The right answer is A. Obturator nerve.